Hi, I'm Dr. Jonathan Glashow. I'm one of the Q coaches with Kinetics. I'd like to chat with you a little bit today about some of the aspects of preventative exercises and how those preventative exercises may help keep you out of trouble with a knee injury in particular. Knee injuries are one of the most common athletic injuries we see, from sports such as tennis and basketball to running and everything else. You can see from the news reels and sports shows that knee injuries are very common in athletes, and athletes spend a lot of time trying to avoid knee injuries. And there are certain things that are unavoidable, but there are things that we can do to lower our odds of getting hurt. One hears about the dreaded ACL or anterior cruciate ligament injury, very common in young women and increasingly common in contact sport athletes. We have certain exercises that I think that can be applied to anybody's routine in the gym, which will make them stronger and less likely to be involved with an injury. For instance, the muscles of the leg, the big muscle groups, both in the front of the thigh, the quadriceps, and the rear of the thigh, the hamstring muscles, need to be in balance. If one is much stronger or weaker than the other, an imbalance that's created there may make it more likely for you or one to injure themselves. Certain exercises, which we'll go over in the tip section, will focus on the specifics of those exercises, but it's very important that side-to-side differences and the front-to-back muscle differences are not so different. So one leg cannot be very much stronger than the other, or not much weaker is how we should say it, and one leg cannot be much more inflexible than the other, and they both need to be strong in the front or the thigh muscles involving the quadriceps as well as the hamstring. But you know, when you look a lot of the athletes who get hurt and you look a lot of the players that get hurt, they're often because there's another joint that's injured. And don't dismiss the fact that if you have a weak ankle or a hurt hip, that doesn't contribute to your knee issue. It's one of the most common causes of knee injuries we see are other ailments that are not addressed. So while I think it's important to talk about the big muscle groups, the core muscles of the front and the back of the thigh, that it's very important that you don't ignore these minor injuries such as Achilles type of pain or ankle type of pain in the same or opposite side, which can lead you to act differently and in compensation hurt your knee. So these exercises are something that need to be known about first. We need to understand what the problem is and then address that particular weakness. But to stay focused on the particular exercises that we're talking about, we talk about closed chain exercises, and you can go to the website or the Q website and we'll talk about a little bit how the foot has to remain fixed while you're doing knee exercises. That's a very important point to try to avoid problems or pains in the front or the anterior portion of the knee while doing it. The other aspect is balance. And without the appropriate balance and balance exercises, we're much more likely to get injured. And we've all seen folks at the gym on those half moon balls that allow you to balance. That's one very important aspect. We've come to understand that without the appropriate balance, the injury rate of knee injuries in young women are 6 to 7 times more likely. So these folks who have had injuries to the knee are automatically put on this preventative ACL program. So to sum it up, we need to be sure that the muscles are strong both in the front and the back of the leg. You need to be sure that the hip and the ankle on the same and opposite sides are also in good shape and not lending itself to overworking the knee, which may lend to an injury. And when we do exercises, they need to be closed chain, and we'll talk a little bit more about that in this tip specific section or on the website, where the foot is fixed like a leg press or a squat as opposed to a leg extension, which could lead to other issues. And I think those are some good broad stroke starting points of how one can use exercise to prevent injury in the knee.